Wow, look at this, Renee. I get to hang out outside today. What are you doing?
Yeah, I'm at home. I'm not outside, but it looks really pretty. I like that porch that you're sitting on. It looks nice. Where are you
Yeah.
today?
In the Ozarks, overlooking the golf course.
Okay, that's nice. Nice deal. So you're out and about at the Missouri Rural Mental Health Conference, is that correct? And it's down in the Ozarks is where they're having their meeting this year?
Absolutely. We're back at the old Kinderhook. We've done a number of conferences here. You've been here a number of times
I
as
have.
well, Renee. So
But my burning question is, did you get a booze cruise this time? No. Different
there
conference.
was not a booze
Oh,
cruise.
darn
That was a
it.
different conference.
Different conference,
No,
but
we were
it was
disappointed.
quite
Yeah.
well received. So didn't know if it
It,
was a conference staple or just a one conference situation. I
we
think it's a
we
one
talked
conference.
we talked to a few vendors about maybe introducing a booze cruise in future conferences.
You made suggestions. I like it.
We
So
did.
while you're gone on the farm, what's happening at the farm while you are away? I mean, who's in charge back there?
Well, there's grain to be hauled, of course, but it
Uh,
rained, so I feel a little less guilty. So I
oh,
was
that's good.
watching the weather forecast. Yeah,
So when it rains, you're out of luck. You don't have to do as
I'm
much work.
nope, nope. I feel much better about it. So
Well, that's
I'll
awesome.
relax today. Yep.
All right. Well, today we're going to walk through the agenda for this conference as Jason and Brent are both there. And some of the things they've already got to witness and see, and then some of the things we're headed to next. So to kick it off, your session was looks like one of the keynotes. You weren't even a breakout, and it was about how system changes impact everyone. So what are you talking about when you're out in Missouri? And then how do you think people receive that?
Well, really well. I mean, and it really followed up to kind of the other conversation we're going to have today, Renee, about the needs assessment that occurred down
Mm,
here, and really what they're facing
yeah.
here in Missouri, which is very similar to a lot of states that we see all across the country right now. And that's the challenges of funding and the risk of rural hospitals closing, which is a very
Yeah.
real risk in the coming couple of years.
Yeah. So one of the things that you mentioned that you learned about was something called the Causeway. And I went to look it up, and it must be so new I can't find anything. So what is this Causeway
It's
and what are they hoping to do with it? Sounds interesting.
I have in my hand the 91-page draft report that isn't even out to the public yet.
Ooh.
Um, the Causeway is really the system that the Missouri Rural Health Association put together to get all of their members communicating. And so it's kind of like
Oh,
blog posts and a connectivity tool. I get emails from it all the time. Now and then I click on links and go in and look. They have over 800 people on this,
wow.
and they're rebranding it, naming it the Causeway. And I think we could learn something about it in our state, as could other states. And really, there's a section about billing, there's a section about clinical skills, and it's really for everyone to feed information into it. And really, the cutting edge change that they've developed is that they've done research on what rural health centers, critical access hospitals, providers, what they need. And they're designing the Causeway around that. And the cool thing is they've now integrated AI into it. So when you want to
Ooh.
search for, if I'm having trouble billing a 90871, it'll bring up all of the threads from that people have put into it. So the more people that post on the blogs, the smarter it gets. And so it
Oh,
can
wow.
answer questions for providers. And so it's really neat how they're now developing this so that the more people that ask questions and answer questions, AI will learn from that and be able to then tailor the responses specific to the needs of these providers in Missouri.
Yeah, that's pretty cool. And it sounds like you've got a lot of forward thinking things coming out of Missouri, which is interesting because not only do you have this Causeway conversation, you also did you go to a drone exhibit and it had to do with healthcare? I
Ah,
mean, you've talked about it before with like
I
spraying your
did.
fields, but drones and healthcare, I've never had the thought. What is that about?
It was really quite amazing. As a company here in Missouri that they wanted to start delivering blood, potentially anti-venom for snake bites across Texas. And
Well,
they have drones. And so the drone company went out of business. This company actually bought it, and they're going to bring the manufacturing plant to central Missouri. And they're actually going to build these drones here and sell them all across the country in three states. They're working on getting codes put into place by 2027 that would be similar to ambulance codes so that they can deliver medical supplies. This happens a lot in other parts of the world where you don't have access to a lot of medical care. And so you've got to get blood to a really remote area, say in the Saharan desert or someone else.
hmm,
And so these drones have about a 200-mile range. They go 140 miles an hour, They go straight up in the air and zip off. Look very different than the agricultural drones that we have. I will tell you that. But all providers have to have is one battery pack on their location
Hmm.
and a helipad or someplace for this drone to land. And so the infrastructure is very simple. They send, say, blood out to a rural hospital 140 miles away, and the hospital just has to go out, get the blood out, swap batteries, and push a button on the top, and that drone goes back and goes back home. And it's ready for its next mission. And so it really is interesting to see how this drone technology is going to change how we are able to access things in rural areas.
Wow. Sounds a lot like carrier pigeons, but a lot more advanced. Used to send out pigeons and
It
they'd come home.
it's funny.
Okay.
It's funny you said that because I told Brent we could get one of these drones and he and I could send messages back and forth from our
Oh.
homes. And he said, I think it'd be cheaper to get a carrier pigeon. And so we may look into capturing
So
some
he
pigeons
knows
and
about
training
the
them.
carrier pigeon too. Well, that's really interesting. So before we head into the data section, you guys are heading to a conversation in health with AI in healthcare, and it sounds like you guys met the doc yesterday that's going to do this talk. So did you get kind of a precursor of what he's going to be talking about today, and when you go to his breakout here soon?
Yeah, I think similar to how we're seeing AI developed in the Causeway, I think we're seeing just a lot of medial tasks in healthcare, especially in small hospitals. It can be replaced by AI. We were at a conference a few weeks ago and we saw how imaging, using AI in interpreting imaging over 90% of the time is accurate. So it speeds up the reading of those imaging. It helps to you don't have access to a lot of folks who can read some of those more complicated testing results. I think it has huge implications with behavioral health as well. I think the way that we think about generating notes, looking at audit risk, AI has so much opportunity. And so as I see it, it's just bursting into the field right now. And there's no turning back. I still see some resistance. I hear people talking about some resistance to AI. And I think we need to stop with that. And we need to figure out how are we going to manage it moving forward because it can get out of control, but it's amazing what it can do.
Yeah, I really think that one of the challenges with AI is the misinformation that's been pushed in. And so I think that's where somebody's getting scared because, especially in healthcare, right? If you get the wrong information in healthcare about how to treat somebody or treat
Mhm.
yourself or whatever, you could really harm people. So I mean, there
What
is some
you
reasons to be
s-
skeptical,
you still
but
need a human, right?
yeah,
Right.
yeah,
Somebody explained it really well here. They said AI is kind of like a 5-year-old. It really wants to please you. So it's going to give you back what you
yes,
want to hear.
yes,
And so
yes.
you have to ask it over and over again to kind of press it to get to where you want to be. And so I think because it's in its infancy, we really need to approach it like AI is a tool,
Yeah.
but it's going to try to kind of tell you what you want it to tell you. And so
Right.
you do have to be
Yeah.
skeptical, right? I'm all for that.
And especially from that behavioral health side where they're figuring that out about how it's telling you what you want to hear. And so if you're a person that needs supports and help, it's not trained to tell you, hey, you're not thinking straight, go get help, but it needs to be. And so that's where some of those early conversations about people using it as like a confidant or a friend, or they're just misusing the tool. So you're right. Better training on how to use it as a tool makes a lot more sense than letting people figure it out on their own and use it wrong to their detriment. And so that's a really interesting point. So moving into the data, Jason, you were talking about that rural health assessment. And let me give you some of the just information that I attached this in the show notes for everybody. But Missouri really has the same challenges we do. But here's some of the ones that really stood out to me. They have a 127% increase in fatal drug overdoses. That's a lot. And then 26% increase in
Hmm.
suicide deaths. And but the big one to me that really stuck out that kind of in our world, there's two. One is that they've had a 62% decrease in primary care physicians in the rural areas versus the metro. 62% decrease over just a short span of
Yep.
time. That's huge. And then the other one is that
Yep.
17% of their people still don't have access to broadband to get telemedicine or telehealth. And so when you have a 62% decrease in your primary care and you don't have access, we're talking about some real deserts. And we've always talked about, provider deserts. And we knew this was
Well,
coming. So it's not a surprise. People were aging, physicians are aging out, they're retiring. We all knew it was coming, but I think we're smack in the middle of it now. And we're going to start seeing this not just in Missouri, but everywhere.
Well, I think it's really important to think about, we've done some work in Southwest Iowa And we know how at risk some of those hospitals are. And if you look at this report, the 5 most at risk Missouri hospitals are in the 2-county band that goes along the entire southern Iowa border. And so you
Mm.
could see a line of a very large part of northern Missouri without a hospital. And that affects Iowa because that southern Iowa, northern Missouri, share a lot of the same resources. And so I think we have a real crisis brewing on our southern border of the state of Iowa, because that is going to be a very large healthcare desert, especially as we look toward future closures. And those 5 hospitals across those tiers of counties in Missouri are the most at risk right now to close very soon.
And I would bet you if we look in Iowa, the ones most in threat of closure in Iowa are the ones on our southern border as well. So if we close all
That's
the ones on
exactly
the
correct.
northern border of Missouri and the southern border of Iowa, we're going to have a whole lot of counties without coverage. And I don't know, because we've always used those state lines as barriers. I'm wondering if anybody's even having that conversation at the bigger picture to be like, hey, no one's going to have coverage on either side. Because wouldn't it make sense for them to work? I mean, calling me crazy, but wouldn't it make sense that we work
Yeah,
together and like have
yeah,
maybe 1 or 2 that stay on the Iowa side and a couple that make it on the Missouri
yeah,
side so that you have coverage? But that means you
yeah,
have to talk across the line and work. And
right.
it doesn't always work the way we hope it does when it comes to state lines. Were you going to
No,
talk more about the
I
current
think,
one in your hand that you had, new information?
well, really, this is just the information feeding the developing out of the Causeway, and how the association can best respond to its members, right? Like, is it virtual? Is it online? How do we use AI? To what extent do we go? And it's a really great draft report. I'll be honest, I haven't gotten through all 91 pages. It was handed to me yesterday morning. My presentation followed Derek, where he kind of laid out the nerdy, this is why we need to do it. And then I stepped in and said, well, this is what we do. We don't mess around waiting for all the research to come in. We just want to go out and start having conversations and get some action going. And so it was really a nice dovetail presenting yesterday, and it was a lot of fun, created a lot of energy of folks who want to go out and figure out how do we change our system, and how do we start doing more with the less that we have, because there is potential.
Yeah. For our listeners, as we move out of the data section, one of the reasons we're having technology challenges, Jason, would you like to explain your tech challenges while traveling?
I should know better than to try to update. There was a really big, shiny new update that came out for all of my Apple devices, right? My phone, my watch, my iPad, my laptop. But when you're on the road and you do a major update to all of your tech equipment, sometimes Google will say, we don't know who you are, and you're on a bunch of public networks, and you're not in your local home area. So we're locking you out of everything. And so at this moment, I am locked out of everything other than Zoom. So here I am in the middle of Missouri with no connection to email or the rest of the world at ruralpolicypartners.com.
Yeah.
It's true.
And for those listening, I'm an Android girl and will never, ever own an Apple phone. And that drives Jason completely crazy. But there's why. Because you know why?
Yeah.
Android plays nice with Google, and I don't get locked out of the universe the same way.
Yeah.
So, right
He-
there, my friends, is an
Here,
Apple glitch in
there's
the world.
there's actually a bigger glitch, and that's Renee's our system administrator in the
This is
eyes of
true.
Google. That is the bigger glitch that
And
we discovered this
And
morning.
everybody knows that I'm the tech expert.
Yeah.
There's me and one other board member in the office that were like, you know what? When there's a tech, we're just like, we got it. We are totally going to handle it. And we have no freaking idea. And I mean, honestly, how I became the system administrator actually wasn't my fault. I will not blame that on me, but somebody gave it to me, and that's a very bad choice. So, you being on the road, me being the administrator, I'm not in the same place as you. The whole thing is funny, and super sorry about that.
It's
Um,
not funny. It's actually very anxiety provoking, but we'll make it through.
no, it's gonna be a relaxing
Oh,
day of you
no,
being detached from your
it's true.
devices, and
It's
you can
true.
get a clear head and enjoy the
It's true.
scenery of the lake. And
It's
now
true.
you are forced to rest and be detached.
It's
So there's not
true.
much you can
It's
do.
true.
Um, I will forward everything to Brent that I find that comes our way so that you make sure you're in the know, but that's actually ridiculous. So everyone, while the recovering politician self-care policy of the week is, I've had quite a week at the office, and I'm not even going to begin to explain it, but here's my tip. Go to bed early. When everything fails, And one of those days was yesterday. I was actually kind of grateful that Brent and Jason are out of town because I could just quit. I was like, that's enough of that day. I had enough of yesterday. And so I just didn't turn on the television, kind of kept it kind of dark, not really into stuff last night, and just went to sleep early. And I don't do that very often, but some days, man, it's better than the other results. And I have some coworkers that can use Xanax or can drink Fireball and can do other things to deal with the day. And I'm like, unfortunately, neither one of those work for me. And I definitely wouldn't put them together because those are my prison friends that have both. So I was like, you know what?
Yeah.
I'm just going to go a different direction and just go to sleep. And I feel a lot better this morning. It doesn't make yesterday any better, but I definitely have a better outlook on today, which maybe not worked up this morning when things crash for Jason. And I am a tech administrator when I have no tech skills. I will never claim to have tech skills, people. Never. So the fact that I'm a tech administrator, the whole world should really, really be worried because that's just not my gift. So I'm grateful that I went to bed early because this morning I'd have freaked out about that. But I don't freak out now because I'm like, it'll be fixed when they get back. So Jason, any kind of tips you have for self-care while you're traveling that maybe you picked up on or remembered while you were away? 'Cause you've been gone back to back weeks. Or is there any travel tips for anybody
Well,
that you've been using?
it's the same. It's sleep. Protecting that sleep time and not getting run down. We have too many meetings coming up. Like it's been two back-to-back weeks of travel. I got more travel coming up. We've got really important meetings coming up of some really tight timelines, and so maintaining that routine. I was in bed by 9 o'clock last night. We did end up kind of a later supper, but we're still back because it's just important to stay on that routine and because you got to be on top, you got to be on task, right? When you get up in the
Yeah.
morning, you got to be ready to go. We're up and out early. Had to be here and have breakfast and podcast, and it's not even 8:30 yet. So, I think that's the best thing is sometimes people, we see it here. People go out partying and do stuff, and it just doesn't make any sense because then you're not your best, the next day and the day after that and the day after that. So get
Yeah.
sleep. Mhm.
Yeah, agreed. Well, today, everybody, we were live from Missouri, the Missouri Rural Mental Health Conference. We're having some tech challenges, as you heard, but we learned a lot about new tech, AI, drones, and things that are coming for your healthcare near you. We'll continue to report on those as those new and cutting ideas come out. We'll talk more about those as we travel the country and bring it all to you live. But before we go, don't forget to follow us on LinkedIn, Facebook, or YouTube. And if you leave us a positive review, we'll give you a prize. Thanks, everybody. We'll see you next time.